The deal on the posterior points is that opposite of the anterior points, we're going to rotate toward, we're going to extend, okay? And we're going to rotate toward, and we're going to side bend away. Again, we're wrapping around those points. If I'm at this C5 posterior, which is right here, right? Now think about where it's showing me that I have to go down. So I'm going to extend to it, which softens it a little bit. I'm going to rotate toward it. Now, if you recall, with the anterior points, we rotated toward them. It happened to take the chin away. In these posterior points, it happens to be taking the chin toward it. And then I'm going to, depending upon where I am, I'll add side bending afterwards for a little fine tuning. And I'll support right there. And that's it. So we can start with C3 posterior, which isn't very much extension, and is almost pure flexion. Pure rotation, sorry.
You're in the spinous process, right?
These are all transverse process points.
Oh.
These are posterior lateral points. So yeah, you're not. So if I'm here, here's spinous process, I'm here. Like I was for the C2 posterior. I'm along the space over between the spinous process and the transverse process. Transverse processes are really close to over here. So I'm on the muscle mass over the posterior aspects of the joints.
Can you show that?
So here's like C3, right? So I'm put just enough extension, I can feel it kind of float a little bit. I'm going to rotate toward it, and I'll side bend away. Almost pure rotation, and that's it. Did that hurt there?
It's tender, yeah.
So add a little more rotation. Better? Mm-hmm. Add a little more extension. How's that?
Great.
Yeah. That's it. And again, you want to really manage your body mechanics. Mm-hmm. You don't want to be using your... Notice I've got my elbows resting on me. My hands are in places where I could hold her forever. Nothing's cramping. So that C3, if I got all the way back to C5, let's say C6, that's sore. Kind of. I'm really extending her. I'm rotating her strongly toward the lesion, and I'm pulling her really strongly away, kind of like what I did with those points in the front, right? Pretty strong leverage. That's good there, huh?
Yes.
Yeah. And again, if I weren't happy with her, I would have push into my hands, please. And release. And turn your head up in my hand. Not too hard. Release. There. Good. So that's the posterior points. Again, I'm including the posterior points for completion, for completeness. I don't use them. I use these a lot. Yeah, you do too. You do as well, right? Do you find yourself using the posterior ones much?
Not very much.
Same with you? No, the anterior ones are on the joint. The joint's right there, and somehow they seem way more viable. Every once in a while, if I can't get an anterior one to release, I realize the opposite side posterior. Yeah. So rather than going this way, if I can't get that to go, I realize, I've got to go this way to get that to release. So go to the C5 posterior, and then I can go C5 anterior, and the whole thing will go. Realize that the posterior and anterior points are part of the same segment. Right? Mm-hmm. Good. Going back down, please.
Say it again.
So here we have, when we tuck her chin, what we can see is this line of the ligament here, the interspinous ligament that runs between the tips of the spinous processes, and it lights up this. And if we count down, there's 1, there's 2, the real prominent one, there's 3, which is semi-prominent, and then right past it is that spot in 4. That's the only one that I'm doing. Now, Jones lists a bunch of posterior points because it's a compendium of points, right? So there are all these things in there. I only occasionally, fairly rarely, use the C4 spinous process point. Fairly rare. I never use, I'd say almost never use these, the ones that run along the ligament here. But where we're talking about, do you see this this sort of mass of tissue between my fingers. So these points are going to reside over in the soft tissue, lateral to the spinous process, and the transverse process is way over here. So it's really in the muscle mass. And that's where we're going to be. We're going to use one finger and just sort of run our hand up and find, there are always points in here. So,
lateral to the
spinous process, yeah. If this, can you see this line tomorrow?
Yeah.
This ridge here, that's the spinous process. So we're on either side. In fact, you can see where she's not blanched, but turned red, hyperemic here. You can see, so and there she's blanching. So there's usually some strain, but so in the area where she's red here and here is where we're going. So lie on your back, please.
It's nice of you to care to be hyperemic.
Mark?
What's that?
Anywhere in the muscle mass that,
Thanks.
that,
You're welcome.
that calls you, it's not specific, precise to a vertebrae.
Are these tender points in any way whatsoever related to the anatomy? No. But they are regional, right? So the ones that we're dealing with that are the posterior lateral points, so we are in that posterior lateral mass. Because they relate to the segment, they will relate somehow spatially to the segment. But they have nothing to do with the muscles there. They have nothing to do with the bones that are there. So I tend to start at the bottom, at this bony place here, the vertebra prominens, which is what vertebra?
7.
Oh, wow. Great. I was going to say extra credit, but so
We all
cool.
got it.
Why?
ice
Just because
cream
we all got it?
Get ice cream already.
We don't all get extra credit?
So you can just sort of gently sort of massage and work I'm using my middle fingers, and you'll find a place that's sort of knobby, fibrotic. You can feel energetically. This one I could scan this actually, and there's a hole right there where my finger is. I come on, and there's a spot, like a little grape, that's embedded in her soft tissue mass. And when I press on it, it's pretty tender.
It's okay.
Yeah, I mean,
Yeah.
So that's just somewhere between C7 and C4 on the side there.
I'm not even counting right now. I'm just really feeling feeling where I am. And one segment below that, there's one on the opposite side.
Yeah.
So what you've got probably is that going on. That being sort of the old, an unfortunate choice of word, the old Indian burn. But it's a counter rotation. And it seems like stuff that's caught in counter rotation is usually the nastier of where two segments, where the brain loses two segments in the opposite way. So, well, I'll try here. Oh, that didn't work. I'll try here, and the whole thing goes like that, and the brain can't figure its way out of it because the data out are too contradictory, it seems. And I'm just getting used to where I am in this space, right? And we're just feeling our way through. And then further up, at the level of C2, the one on the right is kind of knobby, but the one on the left is really, so there's something going on at the C2 level where both sides are affected. The left is certainly way more prominent, right? So, I mean, I'm throwing out vertebral segment names because I sort of know where I am, but I know that there's something going on up here, and I know that there's something going on down here somewhere, you know, and we could start at 2, knowing here's the bottom of the occiput. We could start at 2, and we could just sort of work our way down to 2. There's 3, not much going on there. There's 4, not much going on there. There's 5, and that's that counter-rotated guy that's right on the right, and actually, and it's 4 that's counter-rotated to the left. Well, let's just say opposite tender points, right? Where if they're on opposite sides in different segments, if this one's here and this one's here, and they're posterior, that means we've got to go this way for one and this way for the other, right? So they imply that you're going in opposite directions. But just still trying to sort of know where I am. Here I am down here at C7. Now, is it important that you know what number you're at? Thank you. I'm glad you said that. Really doesn't, I mean, I don't, other than a couple obvious places, it doesn't serve you or the client to really be anal about, am I at C5? I mean, if you're taking notes and you're charting stuff, it might be necessary, but we're gonna find the point and treat it, right? And it doesn't matter where it is if we get our vectors right. If we know that we're sort of in the middle of the neck, then we know that there's sort of a middle amount of extension, a middle amount of rotation, a middle amount of side bending, right? That's all. So it's kind of cool that way. So I'm going to start with the one at the very top. And remember we talked about our axial extension? What did we talk about?
Axial extension.
Thank you. What does that mean?
You're going to do that concussion.
Yeah.
You buckle.
Bow it.
It's bowing. It's a bowing.
Her axial bowing.
Yeah, it's an axial bowing, really. But because everybody's bending back, they call it extension. You could do axial flexion, too, right?
It's like when you take a playing card and you squeeze the top, you're holding it, that's what you're doing.
That's the axial.
Yeah, you either do it in
Well, it's extension if it goes backward and flexion if it goes forward. Like there are specific positional things that require extreme extension with axial extension superimposed, or flexion with axial extension, where we bring her in flexion and then from here bow her down like that, which would be axial extension superimposed upon spinal flexion. Right, just so we know what's going on, right? So C2 on the left was the one that spoke to us. Yeah, it's a nasty. I'm not even going in very hard. So I'm going to put her in the position as if it's a C2 transverse process, as if it's the one there. But I'm not. I'm staying on it with my opposite hand. Actually, I'm not. I'm going to stay with it on the same side. So I'm going to monitor it with my left hand and come around kind of far. I'm not holding her head up. It's just sitting in neutral, rotated left. I'm going to take it's like, if you can see where my hand resides, this is the eminence. We talk about the parietal eminence or the parietal boss, where her little horns would be. And I'm resting that in the hollow of my hand with my thenar eminence just above it. So if you look where my hand is coming, it's kind of along the midline of her head. So I'm just beneath it, and I'm locking my elbow in. I found the place here with full rotation, and I'm just dropping forward and leaning. And immediately that melts.
And you're holding the point on the other side.
Yeah, I'm monitoring. My hand is barely touching her. My left hand is barely on. I'm going to take some different angles of this, maybe.
That's a good shot.
So you're leaning and your force is going down that way.
Yeah. My force is headed toward her right knee. And I'm monitoring it. So if you notice, on this side, this hand is basically free. It's not doing anything.
except monitoring the point.
I've got my third finger on the point and listening, and it melted. It just melted. And the whole system and the whole dural tube and the membranous sacrum are working. Now, would it be possible to get seduced by all these phenomena? I say, yeah. And so we linger and, we go to bed at midnight again or something. No. So really, where's the sign that says do not linger? So we're really,
But don't linger.
So,
well, we're staying, when people linger, it's because they start looking at all the whole body phenomena. Keep your focus on the local point. When it becomes non-tender and you feel breath and flow, often there's a little tapping of the chi, a little chi pulse that's different than the blood pulse. That's kind of a cool thing to see. And you start to feel that the points kind of reverse its vortex and kind of come back out and kind of float out to the surface and just kind of breathe. When it happens locally, even though but what about the sacrum? And what about the dural tube? And what about the tent? It's like, just get off.
So all the posterior points, you do that axle?
No.
No, just
Only C2.
C2. Okay.
Yeah. Do y'all get that?
Yep.
Right?